everyone. So in the last video we treated infections caused by microfilariae, like lower infections and river blindness infection. So today we'll be talking about another infection known as smallpox. So basically, this smallpox, it is a highly contagious and deadly viral disease, and it was once a known major global threat. So this smallpox, it is majorly caused by variola virus, which belongs to the orthopoxo virus genus, and the disease is characterized by fever, fatigue, and a distinctive progressive skin rash. So thanks to the massive global vaccination campaign that was organized by WHO, this smallpox was officially eradicated in the year 1980, which made it the first human disease to be eliminated globally. So looking at the background, smallpox has existed for thousands of years, with evidence of the disease dating back to the ancient Egyptian mummies. So it caused millions of deaths across continents, and it played major roles in the history by decimating populations, especially during colonization and war. So this smallpox, it has two clinical forms. First, we have variola major. So variola major is the more severe form with a higher mortality rate. Then we have variola minor, which is a milder form with a lower mortality rate. So the transmission of smallpox was through respiratory droplets or direct contact with the infected person's bodily fluids, or through contaminated objects like bedding or clothing. So it had no known animal reservoir, like any known transmission from any animal. So looking at the signs and symptoms of smallpox, so the symptoms typically appear between 7 to 17 days after the infection, and the symptoms include like number one, high fever between 38.5 to like 40 degrees Celsius, then fatigue and general feeling of not feeling well, like known as malaise, then headache, and sometimes back pain, then severe abdominal pain, which can happen sometimes, and vomiting. So after the initial phase of this disease, a rash appears. So this rash, it starts at macules, then papules, then vesicles, then pustules, and finally forms scabs. So this rash, it begins on the face. It begins on the face and the extremities, and it spreads to the trunk. So the lesions are usually deep, they are usually firm, and they are all in the same stage of development, unlike chickenpox. So some complications might include blindness from corneal ulceration, then encephalitis too can occur, and then some secondary bacterial infections, and also scarring. So these are the complications that can occur when this smallpox infection gets into the severe phase. So looking at the clinical presentation, so a typical patient with smallpox would present number one, sudden onset of high fever and general feeling of unwellness, and then followed by a painful rash. So the rash first appears on the face, then it will appear on the hand, and then it will spread to the arms, the legs, and the trunk. Then all the skin lesions, they appear to be in the same development stage. Like you won't see one that is bigger than one or one that is smaller than one. They always have the same size, basically. So also the clinical presentation you'd see is the patient will also tell you that they've been in close contact with an infected person, because this is how it's transmitted from contact with an infected person's bodily fluids. Then also the person would also mention that they've had no prior vaccination against smallpox in recent generations. So the rash evolves predictably over about 2 to 4 weeks, and it ends in crusts that eventually fall off and leave scars on the body. So looking at the cause of this smallpox is caused by the virus known as variola virus, which is a member of the orthopox virus group. And the two strains, like I mentioned before, are variola major and variola minor. Variola major being the more deadly form, variola minor being the less deadly form with low fatality. So the virus is transmitted person to person, either through airborne respiratory droplets from coughing or sneezing, or direct contact with fluids from lesions or scabs, or from contaminated objects. So these are the three ways that this virus is transmitted. So looking at the risk factors, before the eradication of smallpox, people at the highest risk included: number one, unvaccinated individuals; then two, healthcare workers treating infected patients when they don't wear their proper protective gear; then people in crowded living conditions too at high risk; and individuals with weakened immune system. So that was before the eradication, but today the primary risk factor comes from laboratory exposure or potential bioterrorism threats, because the virus only exists in secure labs in the United States and in Russia. So these are the risk factors today, because this smallpox has been successfully eradicated globally. So looking at the anatomy and the physiology, smallpox, it affects primarily the skin, the mucous membranes, the lymph nodes, and the immune system. So the variola virus, it enters through the respiratory tract. It infects the mucosal surfaces and it spreads to the regional lymph nodes. So it causes viremia, that is when there's virus in the blood, and it leads to widespread infection of the skin and infection of the internal organs. So the skin damage results from the viral replication in the epidermal cells, and immune invasive mechanisms of the virus lead to intense inflammation and also tissue necrosis. So for the pathophysiology, the virus enters the body through inhalation. Then it infects the upper respiratory tract epithelium and spreads to local lymph nodes. So this leads to primary viremia, that is virus in the blood, and this is where the virus basically spreads to the spleen, the liver, and the bone marrow. So a secondary viremia follows after the primary viremia, and this secondary viremia, it leads to viral replication in the skin cells, especially in the epidermal layer, and the immune response contributes to fever, toxemia, and inflammation. So the result is the characteristic vasculopustular rash and systemic illness. So the characteristic rash that we see in smallpox is the result of this immune response. So looking at the diagnosis, smallpox is no longer common nowadays. Diagnosis included, like, for example, clinical examination, like key features of the rash, the distribution, the history of the patient, then also electron microscopy to visualize the pox virus particles, then PCR testing for genetic confirmation, Then culture culture in the lab, only which was only done in high security labs. Then also serological tests to detect specific antibiotics. So in the case of bioterrorism events, rapid diagnosis is crucial to contain outbreaks. So for the differential diagnosis, that is like other conditions that could mirror this smallpox. For number one, chickenpox, which has lesions in different stages. That is the difference. So for smallpox, you see lesions that are all in the same development stage, but when it comes to chickenpox, they all have different stages. And chickenpox lesions, they start from the trunk. Then monkeypox too. Monkeypox has similar rash with smallpox, but is often with lymph node swelling. Then for measles, there would be a maculopapular rash, not pustular rash. Then some drug reactions too may resemble the rashes that are seen in smallpox, but they may lack systemic signs that you see in smallpox. Then syphilis or scabies, they cause skin lesions without fever and progression patterns. So these are basically the other conditions that could mirror the same symptoms as smallpox, but with differences. They just have some similar signs. So looking at the management and the approach considerations, since smallpox has been eradicated, routine treatment is no longer practiced like as before. But if re-emergence occurs through maybe a lab accident, the management plan would typically include number one, supportive care like hydration, nutritional support, antipyretics for the fever, pain management with analgesics, then giving antibiotics too if secondary bacterial infection develops. Then looking at the antiviral agents that we can give. So tecovirimat is an antiviral approved for emergency use against smallpox. Then cidofovir is also used like as an experimental antiviral in the lab. Then for the vaccination, so smallpox vaccine can prevent the disease if it's given within 3 to 4 days of exposure. So if the patient has been exposed to exposed to someone that has smallpox, so giving the smallpox vaccine within 3 to 4 days of exposure can prevent the disease from how do I put it, from resurrecting. Then vaccination also reduces severity of the disease when given up to a week after the exposure. So isolation too is the last one. Immediate isolation of the patient is needed to prevent the spread of the smallpox, and the use of personal protective equipment by healthcare workers, which is very important to prevent the transmission of this smallpox, especially when they are dealing with a patient that has this condition, because the fastest way for an infection to become an epidemic problem or a pandemic problem is through the transmission of this infection from a hospital, because a hospital has several patients that might have weakened immune system, several patients that it's just, once this infection is picked up by a healthcare worker, it's usually very hard for it to be eradicated, because you have to start thinking, who has this healthcare worker been in contact with, who has this healthcare worker also gone to see, like all these other things you have to put it into consideration. And then before you know it, it just becomes a big problem, a problem that would have just been solved if this person just had the time to use the proper personal protective equipment. So isolation is a very key factor in management of this disease. So looking at the prognosis, so for the first form, that is variola major, that is the more severe form, the mortality rate ranges between 20% and 40%, depending on the health and access to care. So variola minor has a better prognosis and less fatality. So the survivors of this smallpox, they often have permanent scarring, and some experience blindness and permanent neurological damage. So with the disease being eradicated now, the focus is now on the vaccine stockpiling, making sure enough vaccines are produced, laboratory security, and preparedness to prevent future outbreaks. So that is basically it about this condition known as smallpox. So currently it has been eradicated and it has been reserved. So hopefully there are no potential outbreaks in the near future. So that is all for this topic. Thank you.